Hello and welcome to the Thrive Programme podcast. Today we've got the lovely Cara, and today's topic is key things to know about vaginismus. So how do you know so much about vaginismus?
Right, okay. Well, first of all, thanks so much for allowing me to talk about this subject, because unfortunately it is a topic where there are so many myths and misconceptions. I basically started out in the year 2000, which does age me somewhat. And I've done all sorts of therapies and interventions. And all the way back then, I remember working in my sort of training days when I was practicing. I do remember working with a woman with vaginismus. So it's always been of interest to me, that particular area, but it's kind of gathered steam. So the more clients with vaginismus I've worked with, it just kind of becomes self-perpetuating. So I've spent years now very in-depthly working very in-depth ways with women with vaginismus, understanding the kind of mindset that creates it, the physical responses, the obstacles that women with vaginismus experience in overcoming it.
And you are the resident expert for the Thrive Programme. You've written a whole programme specifically for women who struggle with vaginismus. What are the key things that we want people to understand about vaginismus?
Okay, so one of the main things is that it is a psychosomatic symptom, in that, well, first of all, let me describe what happens when vaginismus occurs. So basically, when a woman tries to insert something, whether she is trying to insert a tampon or trying to have sex, one of the ways that vaginismus manifests itself is it just feels like they're hitting this wall. Yeah, and either nothing is able to go in, or if it does, it feels really painful.
Mm-hmm.
Okay. And it is a physical response that is happening, but it is caused by the way that we think, certain beliefs that we have about our bodies, about penetration, and also just the expectation of, well, I think this is going to hurt or this isn't going to go in, causes this kind of bracing response. So when penetration is attempted, it just doesn't happen, which is incredibly frustrating and incredibly disheartening for the woman, because often she really wants it to happen.
Yeah. Yeah.
And I should also say, actually, the other slightly confusing thing about vaginismus is there's plenty of women who are experiencing something very similar without trying to insert something. So very often women are fearful about trying to insert anything. And that fear in itself can prevent them from even trying. And probably if they did try, they would experience that wall, because they would be clenching themselves tightly.
Do you know how many people struggle with it? I guess it's probably like many of these things, it's not talked about so much.
Oh, absolutely. There's a huge stigma around it. And so much felt by the women who suffer from vaginismus. They feel ashamed, they feel embarrassed because they don't understand what's going on. They feel like there's something wrong with them. They don't feel womanly, they feel broken.
Mm.
If you Google this, you'll come up with all sorts of statistics ranging from 1% to 10% to even more than that. The reality is we've got no idea, because lots of women have vaginismus and they don't know that they have it. They don't know that there is actually a name for it.
Okay.
Okay. Or it could be that they're too embarrassed to seek help from their doctor. Or it might be that they do go to their doctor, and unfortunately their doctor doesn't recognise what the problem is. And I've worked with plenty of women in the past who've had unnecessary surgeries on their vaginas.
Wow.
Yeah, absolutely, because it's mistakenly treated as a physical problem.
So what are the obviously the Thrive programme helps somebody to manage their thinking and look at the beliefs and the way that their thinking affects their body in this case. But what are the sort of more other interventions that somebody might have gone through before they come to get help from here?
yeah, there's all sorts of things out there, and I do really feel sorry for any woman who's investigating how to overcome vaginismus, because it really is a minefield. So there is everything from dilators. So dilators are plastic or silicon objects that women that vary in size from small to large or small to penis size that women can practice on. I do rate dilators because they give women a chance to try penetration, ranging from a small size dilator all the way up through to a large size dilator. But the problem is that when women buy dilators, they're given the briefest of directions. You know, they're told to get comfortable, to relax, but there's so much more to inserting dilators than just breathing deeply. You know, because vaginismus itself, the tensing of the vaginal muscles, that's a really simple process. You know, all that's happening is the woman's trying to insert something and she's squeezing her muscles together. But to me, that's such a tiny, tiny part of what's going on with vaginismus. I think that end result is 5% of vaginismus. The other 95% is all the thinking and the beliefs and the expectations that are going on before that physical response happens.
Yeah.
So really, dilators used without any sort of knowledge or understanding is just dealing with that tiny part of the actual symptom.
Which is where the Thrive program is great in any symptom, isn't it? You know, what you see on the surface, I like sometimes you describe it with an iceberg picture, don't you? Where the little bit that you see on the surface, the visible thing, in this case, vaginismus, it could be school avoidance, it could be anxiety in social situations, but that's the bit that we see. But actually what's driving that, you know, a lot of interventions will just tackle that superficial behavior on the surface, but not really deal with the fundamental things that are driving it in the first place.
Absolutely.
So what is under the surface for vaginismus then?
Okay, so I would say the main component that causes vaginismus is women just not feeling or being connected to their body, to their vagina and how their body responds. And that can be for a whole number of reasons. It might be because they're quite squeamish. So a lot of women can feel quite icky at the thought of, say, inserting their finger or inserting something else into their vagina. So women can feel quite disconnected from their body, also because of maybe religious reasons. So maybe they were brought up in a religious household that preach very much that, you know, you shouldn't touch yourself down there, or you know, wait until your wedding day to have sex, and that can build up a whole lot of expectation and pressure for when sex actually does occur. But really, vaginismus is very much just about the woman feeling quite out of control as far as her body is concerned, not quite understanding that mind-body connection. Yeah, and because she feels quite out of control, her way of responding to that is by clenching up, protecting herself, and those kind of responses.
So are there other psychosomatic type things that you'll often see in somebody with vaginismus? There might be other things like that, the mind body.
Absolutely. So women with vaginismus can also have other symptoms like health anxiety if they overthink their body and particular symptoms they have. And also quirky little symptoms like, for example, they might not like swallowing tablets. And there is a correlation there between not liking swallowing tablets and vaginismus, in that it's all about putting a foreign body into themselves and feeling anxious. So when you have
having to override that default, this is dangerous, I can't swallow this, I'm going to choke.
Absolutely. What if I choke?
Make you feel like you can't swallow something.
Yeah. So as much as vaginismus does feel very much like a standalone symptom and there's nothing else like it, actually there's big correlations between vaginismus and other symptoms, you know, including even something like blushing, which, you know, most of us can experience. When we blush, obviously it's a physical response, but it's caused by us feeling embarrassed on the spot. Yeah, so it's those kind of feelings that are having that physical manifestation.
So it sounds like there's lots of things going on under the surface, that iceberg analogy. There's quite a few different things happening that actually, as much as somebody might come to you for some help with vaginismus, probably most things in their life, there's other situations that are non-bedroom related or non-period related that actually
Yes.
improve because there's other things that are holding that person back.
Yeah, always. Yeah. Or another analogy I can give you is if you imagine a nervous passenger on an aeroplane, so they've hit some turbulence, and when that's happening, they're gripping the armrest of their chair. Okay, and of course that's a very physical response, but it's caused by their thoughts of, oh my God, the plane's going to crash. And that's the thing with vaginismus, because we don't see our thoughts, we don't see our beliefs or our mindset. What happens is we get this physical response and it feels like it's just happened out of the blue. Yeah, when really, actually, when you get more self-insight, you can say, well, no wonder I was tensing up because of those particular thoughts that I was thinking. And then it starts to make more sense.
So how does somebody overcome it? What are the key things somebody would need to do, think differently, change, challenge in order to not have vaginismus anymore?
So the first step is to understand what's causing the vaginismus. Because knowledge really is power when it comes to overcoming this. Because without that knowledge, it feels as though vaginismus is this unconscious response that you have absolutely no control over. So it's just teaching that awareness. And then beyond that, it's a matter of teaching people how to feel in control. I mean, with, a big component of vaginismus free is the Thrive program, and anyone who does the Thrive program learns how to feel powerful and they learn how to feel in control. And that's exactly what these women learn, how to feel powerful in control generally, but specifically when it comes to their body and when it comes to penetration. And they're also taught the steps of how to overcome vaginismus. So with vaginismus, no woman goes from having full-blown vaginismus to great sex the next day. There's a number of steps along the way that they go through in order to get there. Okay, so it's about teaching women how to have the coping skills, healthy control in order to go through those steps in order to achieve comfortable penetration.
And that's where you said dilators, you think, have a place. There's a place in helping somebody, but actually there's a bit of work to do beforehand around your thinking and building your coping skills that help somebody. The process of that using the dilators becomes much easier, much more successful then, because they're doing it with the right cognitive skills, the right emotional skill set.
Yeah, absolutely. So you have to do the groundwork in order to properly overcome vaginismus, properly and completely. You really need to do the groundwork, say, learning to feel powerful, in control, learning those coping skills. And it's only when those things are in place is a woman in a position to then start becoming acquainted with her body. And doing penetration exercises. And I really do recommend for any woman starting out that you start off just very gently in terms of even just getting a mirror and looking at your genitals in the mirror. So a lot of women with vaginismus feel quite uncomfortable about doing that. But actually, the more powerful you feel, the more you put that into practice, the easier it gets. And that's quite a big step in terms of connecting with your body. And then beyond that, it's just, again, starting off small, starting with, maybe at the tip of a cotton bud or the tip of their finger if a cotton bud feels a bit too pointy, and just feeling around the sort of outside vulva area, which is the outside vaginal area. So it's done all very slowly and gradually. But what's so important is when women are doing these exercises, it's about how they're processing their successes. Because here's the thing, women with vaginismus, because they can be quite hard on themselves, when they manage to insert something, maybe it might be a small dilator or the tip of their finger, they don't think, wow, brilliant, I did that. this is the first step in me overcoming vaginismus, they're thinking, well, it's not a willy, is it? Or I've got so much further to go.
Yeah,
So I don't
everyone
do.
else is doing this every night, and here I am just with this.
Absolutely.
Mm,
And it's so easy to compare yourself to this perfect person who's
mhm,
just gliding seamlessly through her dilators. And the thing is, that perfect person doesn't exist. You know, for every woman overcoming vaginismus, it's not this linear process. You know, it can be a bit all over the place.
mm,
So it's about learning to process and feel good about those smaller successes that are going to take you up to the bigger ones.
mm. So this is more of a, taking the demystifying what's going on, and making the, genitals and things normal, familiar, understandable, predictable, within your control.
Yes, yes,
That's a
absolutely.
big part.
Yeah, absolutely. And predictable, that's such a great word to use, because when women are fearful about engaging with their vaginas, it's very often about the unpredictability.
Mm,
I don't know what I'm going to see. I don't know what this is going to feel like. So actually, when they're doing these things, they're learning these things, and it's done in a very controlled way, it becomes predictable. And when
mm.
something is predictable, it stops being scary and it stops being
Yeah.
overwhelming.
Yeah. Well, it feels safer, doesn't it? And it feels, yeah, you feel more confident going into it because you know what to expect, you know what you're going to get.
Yeah, absolutely.
When
Yes.
actually, if a lot of their lives, all they've done is almost avoided anything to do with that area of their lives, you can
Yes.
understand how it does feel very mythical, and outside their control, and unpredictable, and
Yes.
ununderstandable.
Absolutely. And vaginismus, like all symptoms, when you start avoiding something, you're giving yourself the message, this is scary. I can't deal with this. I haven't got the coping skills.
Mm, mm,
But
mm,
this isn't exposure therapy,
mm,
so when women do the vaginismus free program, it's not about throwing them into the situation where they're, just given dilators and told to crack on. It's done in a really slow, gentle, controlled way. So they're
mhm,
building up their beliefs and they're building up their skills along the way.
mm, mm. And in your experience, how much do you think the medicalization and what they have maybe been told or learned from other sources has disempowered them from being
Yeah,
able to overcome it?
great point. So the vaginal spasm has been the defining characteristic of vaginismus for the past 150 years.
Mm,
So basically, in the DSM, the medical Bible, we've been told that the vaginal muscles are spasming, and that's what's causing vaginismus. That's what's causing the pain. And the reality is that isn't true. Okay, when a woman has vaginismus, her vaginal muscles are not spasming. There's no evidence for that. And it's so important for women to know that, because if you think about your vaginal muscles spasming, it does sound like this big out of control physical response. Whereas the reality is it's so much simpler than that. It's just women squeezing their vaginal muscles together. Yeah, and it's no more complicated than that.
mm,
And they're only squeezing those muscles in anticipation of penetration for as long as they're thinking, I can't do this, or this is going to hurt. As soon as they stop having those scary, catastrophic thoughts, those vaginal muscles will relax. They'll go back to their default relaxed state.
mm, mm,
Okay, so there's no vaginal spasm going on. If you've seen that on the internet, it's not true. There's no evidence for it. It's much simpler than that.
mm. I guess it's similar. So if we were talking men for a second, but the loss of erection and things like that is again a thing that's driven by our thinking. So if a man is imagining having a struggle in that area, or not being able to get erection, it's, that's going to have an effect then on your bodily response, and you're far
Yes,
more likely to struggle with that. And again, that's entirely something in your head, isn't it, that's driving a physical symptom. And there's other ways of managing physical symptoms. There might be other medical models of but actually the biggest
yeah.
factor there is you're inside your head.
Yes, absolutely. And actually, that's a good point, because one thing I should say is that in some cases where when a woman is experiencing painful sex, it can be due to another physical conditions. For example, she might have thrush.
Mm-hmm.
So I do recommend that for every woman who's in any doubt at all, do go to your GP, do just, seek that diagnosis, even just to reassure you there's nothing physical going on.
Yeah.
And actually, the same can apply to men who have erection difficulties. Sometimes it is caused by an actual physical response that's unrelated to their mind. But yes, in the vast majority, especially of younger men, when they have erection difficulties, it's caused by, pressures they're putting themselves under in the bedroom, fear of, oh my God, what if it goes droopy? And then that becomes a self-fulfilling prophecy.
Yeah. So understanding your mindset and how your thoughts affect your feelings and how your feelings affect your bodily sensations and your bodily movements helps you unlock at least that line of questioning, doesn't it? Hold on a sec. What was I thinking? What was I imagining?
Yes,
But again,
absolutely.
most of us don't think in that way because most of us will look for an external or a medical cause because that's an
Yes.
easier thing in terms of information and getting our hands on an answer somewhere. That's an easy thing to think about, isn't
Yeah.
it?
And absolutely, because our vaginas are real, visible, tangible things.
Mm.
So when a woman is trying to insert something and there's a blockage, it's like, well, it must be because of that thing that I can see down there,
Yes.
rather than what's actually causing it, which is what we can't see up here.
Yeah.
It's really difficult for any woman who doesn't have the insight into vaginismus. It can feel like this absolutely overwhelming, complicated condition,
Mm.
whereas actually, when you break it down, you can really understand all the things that are going on in order to create it.
Mm. Mm. Yeah. Good. So in terms of the key things then, so you've got it's a psychosomatic thing. It's not just a purely physical thing,
Yeah.
and that a lot of the medicalization of it or a lot of the understanding that we have is not necessarily the only way of thinking about it.
Yes.
What else have you got?
Ah, so the other thing that's really key for women with vaginismus to know is that often it is not at all caused by some sort of past sexual trauma.
Okay.
Because I have worked with women who've been reluctant to seek any help in terms of psychological help because they're worried about, oh my God, what if I find something out that I don't want to know? So the vast majority of women that I work with and women who do my program have never had any sort of horrible sexual trauma. But we don't need to have a trauma in order to create a symptom or an anxiety.
Mm.
For example, if you take somebody who's got a fear of snakes, okay, or there's millions of people with a fear of flying, it doesn't mean that they've had some sort of horrible situation on an aeroplane. They might have
Mm.
experienced a bit of turbulence, but that's not necessarily trauma.
Mm.
But we can create symptoms without having a preceding event that's caused it.
Mm-hmm.
Even just the thought of, when I have sex, what if that hurts? What if I bleed? And then if you continue to worry about it, you can make it bigger and bigger in your mind until it turns into a symptom.
Yeah. Well, it's very easy to snowball something, isn't it? With a few of those unhelpful thinking styles that you've mentioned there. Very easy to have an idea about something happening or a worry or a fear of something happening, and to then start to feel a bit uncomfortable about that. And then, of course, the more uncomfortable we feel, the way a lot of us will respond is to think about it some more. And
Absolutely.
that then perpetuates or starts the snowball rolling, doesn't it, in
Yes.
terms of the symptom? And I guess the
Yes.
more avoidance and the longer you go on believing in this thing and avoiding it, and it just makes it worse.
So I have worked with women who have experienced some sort of, unpleasant sexual experience in the past.
Sure.
But what I would say is, regardless of whether they have or they haven't, in order to overcome it, the processes are exactly the same.
Mm.
If you feel powerful, if you feel in control when you're in a situation that involves penetration, regardless of what's happened in the past, those feelings will override that.
Sure. So whether there was a genuine start point, if you like, in terms of a bad experience, or whether it was just a thought or an unhelpful idea about something happening, the way that you overcome it is the same.
Is exactly the same, yes.
Mm-hmm.
So you can still feel powerful, even if something quite negative has happened in the past.
Yeah, good to know. So even if something had happened, right, let's say somebody's had it for 25 years, somebody's had it for 3 years, again, is that the same answer?
Yes, in terms of overcoming vaginismus, it's irrelevant how long a woman has had it for, because as long as they learn specific skills and they adopt particular beliefs and they feel powerful about their body, it doesn't matter how long they've had it for, they can absolutely overcome vaginismus. And what I would say is, it does take effort to understand the program and to apply. It's not difficult to understand, but the only person who can help you overcome vaginismus is yourself. Nobody has access to your vagina. Nobody can control your vaginal muscles. So it is up to the woman herself to learn these skills and learn the different techniques in order to achieve comfortable penetration. But actually, what so many women do say is once they start to understand it, it's quite a simple process.
Yeah. And with people that you have helped, so obviously you have written a program, so there's an element of learning about it and understanding it, understanding the different components, parts in their thinking about how currently they're creating this symptom, or how this symptom is fueled by some of these thinking styles. So there's a bit of learning. What does the daily work look like, if you like, over the course of the program?
So the way that the program works is modules. So it's an online program, and modules are drip fed to my students over the course of 6 weeks. And those modules consist of videos. There's a load of videos just directing women, teaching women. It's very practical, so there's lots of practical things for them to do. And there's also written information. So I would suggest if any woman who can spend half an hour, 45 minutes every day for those 6 weeks will learn everything that they need to know. And then beyond that, it's just a matter of implementing that knowledge, okay, which then might take maybe another 4 to 6 weeks in order to completely overcome vaginismus. But it's something that the more effort you put into it, the quicker and more completely we will overcome vaginismus. You get out of the program what you put into it. But what I would say is the feedback that I get from women is that it's enjoyable because it's so relatable. And it's just interesting because you're learning about yourself, you're learning about the way that you think and the way that you respond.
And where I guess, lots of, I don't know, you go to your GP, I don't know how regularly a GP would typically come across somebody with vaginismus when you're working with them day in, day out. So this program you've put together is based on your experience with people that you see every day. So
yes.
You know what you're talking about in terms of what they need to do and the steps they need to take to overcome it.
Yes. I hope so. I mean, I've been working with women with vaginismus for 25 years. So I think, I don't think there's a question that a woman could ask me about vaginismus that I wouldn't be able to answer. But, I'm open to any challenges for any woman out there. Yeah.
And then, so goal would be overcoming vaginismus, but what would be some of the other benefits for somebody getting themselves vaginismus free? So obviously that's the top of the iceberg. There's other stuff. What else can they expect if they were to put this symptom to bed? And
so when a woman overcomes vaginismus, it's so much more than just about being able to have sex. It changes how she feels about herself. Like I say, when women have vaginismus, they feel there's something wrong with them, they feel less womanly. So just being free of that burden and feeling like a normal, I'll put in doing those switch mark things, a normal sexual person, their relationship improves, and they can do other things, like they can use tampons or they can have smears. So actually the impact is so wide ranging. But on top of vaginismus, anyone who does this program feels so much more powerful in all areas of their life, because we're not just working, it's not just about the vaginal muscles. This is about learning how to feel powerful, how to feel in control and confident in all areas of your life.
So they'd be maybe more socially confident, feeling more comfortable in social situations, feeling better able to talk up and articulate their needs in a relationship or in any relationship. Those
Yeah,
sorts of lovely things that we get with taking people through the Thrive program are equally as applicable to the Vaginismus Free program.
absolutely. Helps women in all areas of their life, including how they feel about themselves and their friendships and their relationships, at work, with regards to other symptoms. So very often, like I say, women with vaginismus come to the program having other symptoms and anxieties like health anxiety, or it could be things like fear of dogs or fear of animals or deep water, any situation where a woman can feel out of control. And the program will empower her to feel much more confident, much more in control in those situations, as well as what's going on in the bedroom. So lots of women with vaginismus, prior to doing the program, believe that it's going to be hard to overcome it.
Yeah.
And I do want to emphasize it absolutely isn't, as long as you're following the right approach. And one of the reasons that women find it difficult to believe that they can overcome vaginismus is they might have tried other interventions in the past. So they could be prodding away dilators for, months or years and not having success, and can attribute that to, well, my vaginismus must be really deep rooted or really complicated. And it's not that it is. They're just not looking in the right place to resolve it.
It's
Okay.
like anything, isn't it? You can think you're doing the right effort or putting in the right effort to overcome something, when actually, if you haven't understood the thing in its entirety, some of the effort might be a bit superficial, although you think you're putting in loads of effort. But if it's the wrong kind of effort, or not necessarily the right effort in the right places,
Yes.
you
Yeah,
just
exactly.
feel like you're bashing your head against a brick wall, don't you, the whole time?
Yes. Yeah. And to use Rob's analogy, it's like if you lose your car keys, you lose them in the garden. You could be searching for years in the house and you're never going to find them.
Yeah.
And it's not necessarily that they're difficult to find. You're just looking in the wrong place.
Yeah.
Yeah.
So
Also,
yeah. Go on.
so go on.
I was going to say, so actually having this, somebody like you or our coaches that are specially trained in helping people with vaginismus, it helps you look in the right places and identify these things and give you the missing pieces that you hadn't been aware of before.
Absolutely.
It's quite
Yeah.
empowering.
Yes, because there can be so many red herrings when it comes to overcoming vaginismus, and women believing that they might need to focus on, things that have happened in the past. And it's just not true, because all the while that they're redirecting their efforts into something that's irrelevant, it's taking them away from focusing upon something that will really help them. And also, for a lot of women, having vaginismus becomes so ingrained in how they feel about themselves and their identity that they find it so difficult to believe that they can ever overcome this and enjoy a normal sexual relationship.
Yeah, so that's a massive shift, isn't it, when they don't have that hanging around it, because that's something that would affect you, like many of these we talk a lot about emetophobia, don't we, on our other podcast, and health anxiety. There's so many things that you can struggle with that take up your daily thinking. It's not just like a fear of flying that you might think about every 6 months if you need to go on holiday or something, or you hear a plane every now and then. But this is on your mind. It has to be on your mind, affecting you every day, throughout the day.
Absolutely, yes. And I will say one thing as well, actually. There's so the good thing about having vaginismus or overcoming it, and there is one, is that if we use that analogy, if somebody's got a fear of flying, they might only have a couple of times a year when they can actually put this into practice, when they can actually get on that aeroplane and test their skills. Whereas with vaginismus, a woman with it has always got her vagina on her.
I remember reading that in the book.
So at any given point, she can think, I'm just going to see if I can insert this dilator.
Yeah.
But the reason that women don't is because they're fearful, they're expecting failure,
Yeah.
so they don't try in the first place. But actually, when you start feeling empowered, and you've got the skills, it's something that you can practice whenever you've got a spare moment.
I remember reading that bit in the book. Isn't it around the sort of, people with vaginismus and other anxieties can have a bit of learned helplessness, can't they? In that sometimes you know what you need to do, but there's thinking styles that get in the way of making you feel able to do the thing that you need to do. And I think
Absolutely.
that's
Yes. And a big component as to why lots of women with vaginismus feel that helplessness is if they believe it's a physical symptom.
yeah,
And of
100%.
course you're going to feel helpless. Yeah.
100%. But you know, the main thing then is taking responsibility for you know, once you know that this isn't something that's happening to you, it's not a physiological or a physical thing that's the problem. It's
Yes.
a mind body thing, and that's something that you have power over. That's half the battle, isn't it?
Absolutely. Absolutely. Yes. More than, yeah.
Brilliant. Good. So what would be your executive summary then? How would you summarize? What advice would you give to somebody that's maybe listening to this thinking, oh gosh, this sounds a bit different. Maybe this is something that I might like to try.
So, it is completely different to everything that's out there in terms of the other vaginismus treatments. So I would suggest that the main thing to do is if you go to my website, which is vaginismus-free.com, and there's loads of information on there. There's lots of testimonials as well from women who've overcome vaginismus, so video testimonials and written testimonials, because vaginismus can be such an isolating condition. So I think it's so nice for women to read about other women's experiences. And so many of those testimonials are women not just saying, you know, I've overcome vaginismus, but this has completely changed my life. In so many different ways. And so many of those testimonials as well, the women are saying, I was really skeptical to begin with. I didn't think that anything was going to work. So I think anyone reading that is going to feel quite reassured that they can identify with what these other women are saying.
Well, even the fact that you're listening to people who feel powerful enough to be able to record a video and put their face out there and, you know, talk about their journey coming from something that is something they probably kept secret and hidden for so many years, that's testament in itself, isn't it?
Amazing. Yeah. So all those women who've recorded me video testimonials, I'm so grateful because what an amazing thing to do.
Yeah. Well, it just shows how powerful they feel now and how you know, how much you'd want to help somebody as well. If you don't have the thing anymore and you also don't have the embarrassment or the shame, because you can completely understand now, makes total sense why somebody would have it, right? When you understand the thinking that goes, well, well, we all have thinking things that create problems for us that we could all solve. And it's just one of those things, isn't it? That's holding them back that doesn't have to.
Yes. Yeah. So feel free to have a good look around my website. If you have any questions, I'm really happy for you to contact me. Just ask away. You know, just email me.
Fab. Thank you. Well, we'll get you on again. We'll pick another vaginismus-y type topic and we'll dive in. Or if anyone has any questions or wants us to cover something specific, just get in touch with Cara and we can jump on again.
Yeah, that'd be amazing.
Fab. Lovely. Thanks for coming up.